In this video, we are going to go over some of the basic anatomy of joints, talk about how joints allow movement in the body and the types of movements that they allow, and then look specifically at the knee joint and talk about some different homeostatic imbalances as it pertains to joints. All right, so joints have both a functional and a structural classification. Functionally, they are classified as either synarthroses, which are your immovable joints. Those would be things like the sutures that you see up here as a part of the cranium. There are going to be amphiarthrosis. These are your slightly movable joints. Think of your vertebrae. They allow for some movement, but the movement is somewhat limited. And then finally, we have diarthroses, which are freely movable joints. These are going to be the joints of like your shoulders and your hip and femur joint, which allow for a wide range of motions. Structurally, they can be classified as fibrous joints, cartilaginous joints, or synovial joints. Fibrous joints are going to be those that join bones united by collagen fiber. They will be immobile to slightly movable. So an example would be the connection between the radius and the ulna. Those are all fibrous joints that connect those. Cartilaginous joints, these are going to be joints that are united by cartilage. Things like your pubic symphysis here is an example of that. These again tend to be slightly movable to immobile. And then the freely movable joints are going to be synovial. That's where the adjoining bones are covered with an articular cartilage and separated with a joint cavity. So we'll focus most of our lesson on the synovial joints since they are the freely movable. Notice that because these are freely movable, the synovial joints will be all classified as amphiarthroses as well. All right, so let's look at these three different types of joints in detail. So with the fibrous joints, we have sutures. These are going to be held by short interconnected fibers where the bone edges interlock. So again, these are going to be like your cranial sutures, which are going to be immovable. You have syndesmosis which are held together by ligaments. So this would be the radius and the ulna connection that I was mentioning earlier. And then we have gomphoses. These are your peg in socket or tooth in socket joints. So these are specialized joints that you find holding the teeth into the mandible and maxilla. Cartilaginous joints are either going to be synchondroses. These are going to be made up of plates of hyaline cartilage units. So these are what are essentially making up your epiphyseal plates of your long bones. While the symphysis is like the pubic symphysis, where the fibrocartilage is going to unite the joint, allowing for some movement. The synchondroses, those are essentially immovable, while the symphysis is slightly movable. Finally, we have our synovial joints, which are going to be the most variable. So one example of this is a condylar joint, like you would see in your wrist bones. They allow for biaxial movement, which means that you can have adduction and abduction, as well as flexion and extension. We'll talk about these movements here in a minute. We have a plane joint, which allows for non-axial movement. So these are going to be things like your intercarpal and intertarsal joints. They allow for gliding movements. We have saddle joints, which are going to be made up of the carpal metacarpal joint of the thumb. These allow for biaxial movement, allowing both adduction and abduction, as well as flexion and extension. We have a hinge joint like we see at our elbow, which allows for flexion and extension. We have a pivot joint like the atlantal axial joint. This allows for uniaxial movement or rotation. And then we have a ball and socket joint, which allows for multi-axial movement. This is going to be things like your knuckle and your wrist, which allow for flexion, extension, adduction, abduction, and rotation. So the ball and socket joint is going to be the most versatile in the type of movement that it allows. Structurally, the synovial joints are going to be more complex than the other ones as well. So the term synovial means joint egg. Guess it kind of looks like an egg, or it's kind of like an egg that it has yolk, and so it has a name that's associated with it. The synovial joints are going to have articular cartilage, which is going to be made up of hyaline cartilage. So remember, articular means that it's forming a joint. Hyaline is the specific type of cartilage that makes it up. This keeps the bone ends from being crushed by providing some protective covering for the joints. We have the joint capsule, which is also known as the articular capsule. This is the outer layer made up of dense irregular connective tissue that prevents the bones from being pulled apart, while the inner layer is the synovial membrane, consists of loose connective tissue that is also responsible for synthesizing synovial fluid and secreting it into the actual synovial joint. The joint cavity with the synovial fluid is also known as the articular capsule. It provides a slippery weight-bearing film that reduces friction between the cartilages. Two structures that are commonly associated with joints are the bursae and the tendon sheaths. So bursae and tendon sheaths share similar structures, but they are slightly different. So bursae are like these structures that you see here. They're essentially flattened fibrous sacs that are lined with synovial fluid. They occur anywhere where tendons, muscles, ligaments, skin, or bones tend to rub together. Tendon sheath is essentially an elongated bursa that wraps completely around tendons. It's common where several tendons are crowded together within narrow canals, like you would find in your forearms going to your hands. All right, so that's some of the basic structure. We are now going to talk about some of the motions that the joints allow for in the body. So first of all, we have flexion and extension. So extension is going to be bringing the joint closer in line with the body. And flexion is essentially creating a shortened angle associated with it. So you can see here we have the individual flexing when they bring up their arm or they pull back their leg. Extension is going to be bringing the leg back forward or bringing the arm backwards as well. So you can see forward, we're going into flexion. Extending would be bringing it back, and really this is hyperextension because you're bringing it beyond its normal range of motion. This also illustrates hyperextension. So we have hyperextension when you tip your neck back, and flexion when you tip your neck forward. Here is another example of flexion and extension as it pertains to the waist. Now, when you are moving your limbs on your sides, we either bring them closer together or farther apart. So we have abduction being when you bring it away, and adduction when you bring it closer to your body. So adduction is basically going to add to your central body mass, while abduction brings it away from that. We also have circumduction, like you would have if you move your hand in a circular motion. So this is really circumduction, starting at the shoulder and moving the arm in a circle so that the more distal is going to go through a longer circumference than the more proximal region. We also have lateral and medial rotation. So lateral rotation is moving it out from the body, while medial rotation moves it in towards the body. On the neck, because you are basically centered on the center of the body, it's just rotation that is happening. You're not rotating laterally or medially because you're on the median axis. A few other types of movement. So with our hands, our wrist, or our forearms, I guess is the best way of describing this, you have pronation and supination. So with pronation, you are twisting your arm so that your palm is essentially face down, or facing away from your body. So this would be essentially describing how a pro basketball player would shoot the ball. They pronate their arm in order to do that. Supination. So supination would be like holding something in your hand, like a bowl of soup. You are supinating your arm in order to do that. With your feet, you have plantar flexion. That would be tipping the toes down towards the floor, while if you point towards upwards, it's known as dorsiflexion. With our ankle, we can either tip the sole of your foot so that it is going upwards medially, or you can tip it so it's going upwards laterally. In one case, you have inversion, and in the other case, you have eversion. You can also have protraction and retraction, like of your jaw. If you protract it, you stick your jaw out. If you retract it, you're bringing it closer to your body. So you can take your bottom teeth, you force them in front of your top teeth. That would be protracting your jaw. And if you retract your jaw, and in case you can't tell, I'm doing this as I describe it, you're bringing your teeth, your bottom teeth on the inside of your top teeth. Another thing you can do is have elevation or depression. So with your jaw, if you bring it down, you're depressing it. If you bring it up, you're elevating it. And then with your thumb and fingers, you can have opposition. That's essentially bringing your thumb to the center to meet with another finger. All right, so that describes the general types of motion that are allowed by our synovial joints. I'm going to stop here and start a new video where we'll talk about the knee joint in particular, and talk about some of the things that can go wrong with your joints. So I'll see you in the next video.